Hi, I'm Julie Taylor, President of the Academy of Breastfeeding Medicine.
I am Wendy Brodribb, Immediate Past President of ABM.
I am Ruth Lawrence, Past President of the Academy of Breastfeeding Medicine, the founding editor-in-chief of the journal Breastfeeding Medicine, and one of the founders of this now 21-year-old organization.
We're a group of physicians in various subspecialties around the world dedicated to the promotion, protection, and support of breastfeeding and human lactation.
Our mission is to unite members of the various medical specialties with this common purpose, and to ultimately have this be passed on to the public to contribute to the overall health and well-being of mothers and babies all over the world.
We at ABM decided to take a little time to create this video for you, the doctors who care for our mothers and babies worldwide, and for you, the families, to help you do what is best for yourselves and your children.
We are going to go on a journey which will review from head to toe why breastfeeding, the most natural way to feed your baby, is truly the best for mum and your baby. Let's get started.
Breastfeeding helps promote brain and nerve development and maturation, and is reported to help a baby achieve their optimal IQ, so he or she can reach his or her fullest potential through the growth factors delivered in human milk and through the act of breastfeeding itself. Babies also have less of a risk of serious brain infections like meningitis.
The breastfeeding enhances the bonding of mother and baby, partly through oxytocin hormone, which is released through breastfeeding and helps mom relax and feel happier. This not only helps mom and baby, but the entire family.
Stillen fördert die Entwicklung der Augen und vor allem die Retina-Entwicklung, weil spezifische Wachstumsfaktoren in Muttermilch vorhanden sind. Dadurch wird auch die allgemeine Entwicklung gefördert.
Breastfed babies do not catch as many common colds, so end up with less fluid buildup in their ears, thus less ear infections. In fact, babies who eat nothing but breast milk till 6 months of age have about half as many ear infections compared to those who did not.
Babies who are breastfed get less upper respiratory tract infections and may have less risk for developing environmental allergies.
Breastfeeding helps the jawbone and muscles surrounding it to develop better, and teeth tend to be straighter. Nutritive breastfeeding is proposed to be protective against tooth decay, according to some specialists. But this is an active area of research, and the conclusions are not yet clear. Breastfed babies are also known to have a better ability to manage solid food, potentially less orthodontic needs, and possibly a significant early language advantage over bottle-fed children.
Babies who breastfeed are less likely to develop autoimmune endocrine diseases, such as type 1 diabetes, even as adults.
Breastfeeding may have a far-reaching impact on cardiovascular disease when the baby grows into an adult, either directly or indirectly through reducing the baby's future risk of obesity. Nursing infants may have less of a risk of clogged arteries and high cholesterol, thus less risk of heart attacks and strokes as an adult. Active research is trying to tease out these possible relationships.
Babies who breastfeed have less risk of contracting upper and lower respiratory tract infections from viruses and bacteria, which means less colds, less wheezing illnesses, and less viral and bacterial pneumonias. They are 6 times less likely to be admitted to a hospital for these illnesses in their first year of life if they are breastfeeding. Breastfeeding is also protective against the development of allergies and asthma in vulnerable infants with increased risk, and also less wheezing episodes associated with food intolerances and allergies.
Sudden infant death syndrome, or SIDS, is seen much less frequently in babies who breastfeed. Breastfeeding reduces risk of death by SIDS by 71% in exclusively breastfed infants and is reduced by nearly as much in partially breastfed infants. Breastfeeding truly saves lives in this area.
الأطفال الذين يرضعون طبيعياً غالباً يبصقون قليلاً وتقل إصابتهم بحساسية الغذاء وعدم تحمل أنواع الغذاء. كذلك تقل جداً لديهم نزلات الإسهال المعدي واحتمالات الإصابة بالتسمم الغذائي حتى لو كانت متوطنة حيث يعيشون.
माँ का दूध पिया बच्चों को भविष्य में की सारी पेट की बीमारी और कई फूड एलर्जी होने की कम संभावना रहती है.
Breast milk is far more digestible than formula and passes through the GI tract much faster and more easily, promoting intestinal development through its growth factors along the way. Babies pass meconium, the initial sticky greenish-black stools, faster, and there is less of a risk of the development of necrotizing enterocolitis or NEC in preemies and full-term infants that are fed breast milk. There are also probiotic factors in breast milk, which keep the baby's GI tract healthy, which save for bacteria that protect against diseases. Finally, breastfed infants are less likely to develop childhood obesity and also ultimately adult obesity, which has huge health implications.
Breast milk, with its many specific components, helps develop the infant's immune system in ways that formula simply cannot. Colostrum, or the first milk, is especially rich in these compounds and infection-fighting cells. Breast milk helps to protect the baby with hundreds of immune factors, which not only help fight off infection, but help the infant respond better to vaccines and prevent a myriad of infectious diseases. In countries where HIV is prevalent, exclusive breastfeeding reduces the risk of HIV infection in the infant.
Because breast milk helps the immune system mature optimally, babies who are breastfed are less likely to have diseases related to the immune system, including certain cancers such as leukemias and lymphomas. Babies who are breastfed may develop less eczema and immune-related skin problems, fewer environmental allergies, and they may also be at lower risk for asthma if allergies are common in their family. As with many of these effects, the more exclusively and the longer a baby breastfeeds, the better.
모유 수유를 하면 분유를 타거나 우유병을 닦을 필요가 없어서 번거롭지 않습니다.
Now, let's get on to the mother, who also enjoys the benefits from breastfeeding.
Moms benefit with less risk of uterine, breast, and ovarian cancers. Studies report less symptomatic endometriosis, a slower return of menses and longer child spacing, quicker shrinkage of the uterus after delivery, and faster resolution of postpartum bleeding, thus a lower risk of anemia after the baby is born.
아기들이 더 건강하기 때문에 병원에 갈 일이 적어서 직장에 나가는 엄마들도 결근이나 조퇴가 줄어듭니다.
Some studies have reported that moms with autoimmune diseases such as multiple sclerosis, lupus, or rheumatoid arthritis can have their disease progression stalled or slowed by pregnancy and exclusively breastfeeding.
Mothers who breastfeed reduce their risk for many important health issues in their future. Breastfeeding, along with regular exercise and a healthy diet, helps mothers return to their pre-pregnancy weight. Mothers who have successfully nursed have lower cholesterol, less risk of developing adult-onset diabetes, hardening of the arteries, and possibly high blood pressure. These benefits can reduce their risk of serious cardiovascular disease like heart attacks and strokes. All this by just breastfeeding. Even if gestational diabetes or hypertension have complicated pregnancy, breastfeeding may delay or reduce the impact of these diseases on a healthy future. Many of our mothers and grandmothers have been challenged by weak and broken bones after menopause, and early studies suggest that breastfeeding may also reduce this risk of osteoporosis.
Finally, moms who breastfeed often experience enhanced self-esteem. There are several reports of nursing moms having lower risks of postpartum depression. However, we still don't completely understand the complicated relationship between breastfeeding and postpartum depression. In any case, it can potentially help moms' well-being if problems are handled efficiently. Everyone is happier ultimately once things are going well. It really affects people's lives in a global way.
So we at ABM sincerely want to thank you for listening to us describe the ways that breastfeeding can affect the overall health of you and your baby. In addition, it's clean, green, genetically engineered specifically for your baby, and it's free.
You can't go wrong promoting breastfeeding as a doctor
and breastfeeding your baby as a mother.
As we have shown you, it provides nutritional,
immunological,
and psychological support for both mom and baby.
Let us help you in your wonderful journey to contribute to the common good for mothers
all over the world.
You can do it.
We can help.
Thank you.
Thank you.
Thank you.
Thank you.
Wir möchten Ihnen gerne dabei unterstützen.
Thank you.
Thank you.
Thank you.